What is dental bonding and how is it done? Dental bonding is basically adding a bit of material, which is usually composite, on the surface of your tooth to cover either the color or change the shape of it. Now, you have to keep in mind that dental bonding is basically also called composite veneers, and you have two different types of material to be able to put veneers on your teeth. One can be composite and one can be porcelain. Porcelain is stronger, lasts longer, and more expensive, but it does need a little bit of reduction from the surface of your tooth, not a lot. Composite, on the other hand, does not usually need any sort of reduction, but it really depends on where your teeth are situated. For example, if your teeth are really sticking out, then we cannot just go add something else on top and make it even wider and fatter and stick it out more. So each person is different. Whether you need an orthodontic treatment beforehand, for example, an Invisalign or braces, or no, you can right away go ahead and put bonding on, is something that you have to check with your dentist. Keep in mind, a lot of Invisalign patients and braces patients, when they finish their treatment of Invisalign and braces, they then go ahead and get dental bonding. Why is that? Because when we move our teeth and get them straight, sometimes we have these little chips and bumps and breakage and white spots that we want to cover. And to cover them, we have only two materials that are more popular to use. One would be porcelain and one would be composite. Now, how is composite veneers done? Your dentist will basically retract your soft tissue, which is your lips and your tongues and your cheeks. We put a retractor in, we treat the tooth with some sort of acid which will etch the tooth. It's safe and it is done in a safe environment, so don't worry, we will rinse it off. This acid will make the surface of the teeth temporarily more porous, so it has more pores to be able to bond to the filling material and stay longer. Then they use the glue or the bond on the surface of the teeth. We use a blue light to cure that bond, and then the dentist usually will build up the tooth the shape that you asked her to, or the shape that they think is best for you, slowly using composite material. Another time they use a blue light to polymerize the material, and then it's hardened and you can right away go home and eat. But keep in mind, composite veneers do not last as long as porcelain. They do get stained after a while and they are prone to chipping and breaking. We have another video about the comparison between porcelain and composite that make sure you check it out to find out more about it.